Understanding HCC coding is not just about compliance, it's about ensuring your practice's financial health. So let's dive into the world of HCC codes and discover why they add a lot to your bottom line. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 64, Hierarchical What? Why adding HCC codes adds a lot to your bottom line. Welcome to the Medical Money Matters podcast, where we decode the financial intricacies of healthcare. Today, we're demystifying a topic that's critical, yet often overlooked in medical billing, Hierarchical Condition Category, or HCC coding. Understanding HCC coding is not just about compliance, it's about ensuring your practice's financial health. So let's dive into the world of HCC codes and discover why they add a lot to your bottom line. HCC coding might sound like a complex term wrapped in layers of healthcare jargon, but it's actually a cornerstone of modern healthcare reimbursement. Put simply, HCC codes are part of a risk adjustment model used primarily by Medicare and other payers to predict future healthcare costs based on the diagnoses documented in a patient's medical records. But why are HCC codes so important? It's all about risk adjustment. In a system where healthcare providers are increasingly reimbursed based on the complexity of care rather than the volume of services, accurately capturing a patient's health status is crucial. Proper HCC coding ensures that the reimbursement you receive truly reflects the care your patients require and the diagnostic complexity involved in providing care for them. And it ensures that your patient's RAF scores are as accurate as they can be. A patient's risk adjustment factor, or RAF score, is a numerical value used in the healthcare industry, particularly in Medicare Advantage and other risk adjustment payment models, to predict the healthcare costs for an individual over a specific period. The RAF score is crucial because it adjusts the payments to healthcare plans for the perceived risk of the beneficiaries they cover. Essentially, it's a measure of how costly a patient is expected to be. Calculation of RAF score. The base score. Every individual enrolled in a Medicare Advantage plan starts with a base score that reflects the average expenditure for Medicare beneficiaries. This base score is adjusted annually and can vary based on demographics such as age, sex, and Medicaid eligibility. HCC codes. As we've been discussing, patients with chronic conditions or significant health issues are assigned specific Hierarchical Condition Category, or HCC codes. These codes are part of a classification system that groups similar diseases and conditions together, reflecting their expected healthcare cost. Condition-specific risk weight. Each HCC code has an associated risk weight, which is a numerical value reflecting the expected cost to treat the conditions represented by that code. These weights are derived from historical data and are updated periodically. Aggregation of risk weights. A patient's overall RAF score is calculated by adding the risk weights for all the HCC codes that apply to that patient. This includes interactions between the conditions, as some combination of conditions may lead to higher or lower expected costs than the sum of the conditions individually. Interaction factors. Certain disease interactions can affect the risk score. For instance, the combination of diabetes and heart disease might have a compounding effect, leading to a higher risk score than each condition independently. The RAF score directly impacts the capitated payments that Medicare Advantage plans receive from the Centers for Medicare and Medicaid Services. A higher RAF score indicates a sicker patient population, leading to higher monthly payments to the plan to cover the expected costs. Healthcare providers participating in Medicare Advantage plans may also see their reimbursements impacted by RAF scores. Plans may use these scores to allocate resources, set budget expectations, and design care management strategies. Providers may be incentivized to accurately document and code all diagnoses to ensure the RAF score accurately reflects the patient's population health status. Accurate HCC coding is essential in this process as it directly influences the RAF score. Missing or inaccurate codes can lead to a RAF score that doesn't truly reflect the patient's health status, potentially resulting in underfunding for patient care and lower than necessary revenue to the physician. In summary, a patient's RAF score is a critical component in risk-adjusted payment models, influencing how healthcare plans and providers are reimbursed based on the predicted cost of care. Accurate documentation and coding are paramount in ensuring that RAF scores accurately represent the health status and needs of the patient population. Now, let's talk numbers. How exactly does HCC coding impact your bottom line? Imagine two practices providing similar services, but one has mastered the art of HCC coding while the other has not. The practice with accurate HCC coding will receive reimbursement that accurately reflects the complexity and cost of the care provided, ensuring financial stability and the resources needed to offer high-quality care. We estimate that difference in revenue could amount to a 10 to 20% increase in your annual revenue, depending on the percentage of Medicare beneficiaries you serve. Let's take an example scenario. Suppose a patient, Mr. Johnson, has multiple chronic conditions, including diabetes with complications, congestive heart failure, and chronic obstructive pulmonary disease. In a fee-for-service model, without proper HCC coding, if Mr. Johnson's conditions are not accurately coded using the appropriate HCC codes, the healthcare provider might bill for each separate interaction or procedure. For instance, separate appointments for diabetes management, heart failure monitoring, and COPD treatment. The reimbursement received would only reflect the individual services provided, not the complexity of managing multiple chronic conditions. This could result in a series of payments that don't fully account for the resources and time spent on managing a patient with complex needs. With proper HCC coding, accurate HCC coding involves capturing all of Mr. Johnson's conditions with the right codes, such as HCC 18 for diabetes with complications, HCC 85 for congestive heart failure, and HCC 108 for COPD. This coding reflects the complexity of Mr. Johnson's health status and allows the healthcare provider to receive a reimbursement rate that is more aligned with the intensity of care and resources required. The payment would be higher than in the scenario without proper HCC coding, recognizing the increased cost of managing multiple interacting conditions. In a Medicare Advantage plan, Medicare Advantage plans use HCC codes to adjust capitated payments based on the risk profile of their enrolled population. Without proper HCC coding, if Mr. Johnson's conditions are undercoded or not coded at all, the Medicare Advantage plan assumes he is healthier than he actually is. As a result, the plan receives lower capitated payments from Medicare for Mr. Johnson, potentially leading to inadequate funding for his care. With proper HCC coding, accurate HCC coding ensures that all of Mr. Johnson's conditions are documented correctly. The Medicare Advantage plan receives a risk-adjusted, capitated payment that accurately reflects the expected costs of providing care to Mr. Johnson. For instance, With proper coding, the plan might receive a higher monthly payment from Medicare to manage Mr. Johnson's care, recognizing the higher expected costs associated with his multiple chronic conditions. Additionally, many Medicare Advantage plans offer incentive payments or shared savings opportunities for providers who demonstrate cost-effective management of high-risk patients. Accurate HCC coding can contribute to achieving these cost efficiencies by ensuring that care management resources are aligned with patient needs. In both scenarios, proper HCC coding plays a critical role in ensuring that the patient's RAF score is accurate so that reimbursements from Medicare are aligned with the actual care needs and complexity of the patient's health status. This not only supports the financial sustainability of healthcare providers, but also promotes comprehensive and proactive care management for patients with complex health needs. And it's not just about the immediate impact on reimbursement. The implications of HCC coding extend far beyond your next billing cycle. Accurate HCC coding allows for better financial forecasting and resource allocation, ensuring that your practice can continue to provide excellent care without financial strain. It's about building a sustainable practice that thrives in a healthcare landscape where precision and quality are paramount. Remember that HCC coding is more than a coding practice. It's a reflection of the complexity and nuance of patient care. It's a critical component in ensuring that your practice is not just surviving, but thriving financially. Now let's navigate the challenges and arm ourselves with strategies to excel in HCC coding. While HCC coding is a potent tool in reflecting the true complexity of patient care, it's not without its challenges. Common pitfalls like undercoding, overcoding, or lack of specificity can distort the financial and clinical picture of your practice. We've talked previously about undercoding, which might mean you're not getting reimbursed for the complexity of care you provide. Overcoding, on the other hand, can lead to audits and financial penalties. And without specific, accurate coding, you might miss out on capturing the full narrative of a patient's health status. Each error, each oversight can ripple through your practice, affecting not just your bottom line, but also the quality of care you provide. But the challenges don't end there. HCC coding isn't static. It's a dynamic field with codes and guidelines evolving regularly. Staying updated is not just recommended, it's essential. It requires diligence, continuous education, and a proactive approach to keep abreast of the latest changes and ensure your coding practices are up to date. So, how do we turn these challenges into opportunities? How do we ensure our HCC coding is not just compliant, but exemplary? It starts with best practices in documentation and coding. Accurate, thorough medical record keeping is the foundation. It's about painting a complete, precise picture of each patient's health status. And let's not forget the power of technology. Leveraging EHR systems and advanced coding software can streamline your coding processes, reduce errors, and enhance efficiency. As we look to the future, the landscape of HCC coding is poised for significant change. Innovations in technology and data analytics will drive this field forward, making coding more accurate, more intuitive, and more integral to the financial and clinical success of healthcare practices. Don't get left behind. And that's a wrap on today's deep dive into HCC coding. Remember, mastering HCC coding is not just about navigating a complex system, it's about ensuring your practice reflects the true complexity and nuance of the care you provide so you get full credit for the work you've done. So stay informed, stay proactive, and let's transform the challenges of HCC coding into opportunities for growth and excellence. Join me for our next episode where we'll discuss virtual visits and how they can be leveraged for your practice as we head into the future. Code Mastery. Unlock your revenue. Get paid more, reduce coding headaches, and win the coding game. Code Mastery is a program that is designed by physicians for physicians. Commit a small amount of time and effort to learning how to master the coding game and make a huge impact on your bottom line. Information is available at www.healtheps.com.